Okay, let's check another orthosis that we can make out by using this as a base. For instance, we have a patient with finger rigidity, so is unable to flex the interphalangeal joint of the metacarpal phalangeal joint and has to recover this finger flexion. What you can do during rehabilitation is mobilization and active and passive mobilization with the patient, but we can also use this orthosis to provide a force that puts the fingers into flexion for a few minutes during the day, and this additional tool that we can use is meant to give a light stress to the joints, but for a prolonged time. So, in order to make so, we need to make like a pulley system that attaches to the orthosis and can yes, pull each finger into flexion. How to do so? So first we need again our thermoplastic material, and we need to make little pieces that will be attached dorsally to each proximal interphalangeal, proximal phalanx. Again, we try to save as much material as possible. With a piece of paper you can first check how much long you will need your dorsal support to be. Like this is too long. Yes, you want to create something like this for each finger. As always, we make it a bit round. And then we put these first three pieces into the warm water. And we start already working for the last piece, for the pinky, something smaller. So we place each of them dorsally. And we wait that they dry. This way. Of course, with a patient with a rigidity, you may not be able to put all at once, so maybe you will start with one per time or two per time, but in different fingers so that they don't touch each other. And you might see here that they are quite too high, so I'm gonna cut it a bit lower for each of these. I'm gonna start with this one. Okay. And I try to keep the order so that I know that each of them correspond to a certain finger. Okay, so this way. Now what I need to do is also to create a loop to for each distal phalanx, and I'm doing so with the low loop velcro. So for each finger I'm checking the size, the pocket size. So that I make something like this. Okay. I'm gonna do this again for each finger. Each finger, of course, if you have a rigidity problem at the level of each finger, if you have a problem only on one or two fingers, you may decide to do only on that one, of course. Less is more. Okay. Now we need two additional tools. The first one is this nylon wire, very strong, that is used for fishing. And then we need as well this tool to make holes. I'm gonna set as the minimum necessary. Yes. And then we are gonna make a couple of holes for each finger. At this point we take abundant nylon like this. We make a loop. And we pass this loop within the two holes that we just did. So I made it pass through the hole this way, so that when I pull, it closes. Okay, and I'm gonna make a second loop eventually, so that I'm sure that it doesn't lose. But this time I pass through the big loop of the velcro. Okay, and again I go within the velcro of the loop of the wire, then I close it, and then it's fixed. Okay, so this one, for instance, is for the index finger. Okay, and this is the start of my pulley system. The second part is the dorsal edge that I just did. This way. I have to cut the wire, and each of these will pass through a hole into the in this dorsal part. I can either make it with the machine to make holes, or, as in this case, they are already present as part of the thermoplastic material. Go inward, from inward to outward, yeah, this way. Okay, and then I have yeah, maybe it's best to see upward. So now I have the wires that are connected both with the distal part and with this more proximal, so that when I pull, the finger goes into flexion and the metacarpophalangeal into flexion as well. Of course, with a patient with rigidity, this will not be achieved this way, but will be something rather like so. But at this point, if we are able to fix this in this position, the patient can exercise a stretch force, a flexion force on the metacarpophalangeal and the interphalangeal joint for a prolonged time by himself. So now we're going to take this out for a moment, and we're going to make on this orthosis a system to pull. What we need is again a piece of thermoplastic material. Take our original sheet. We're gonna cut a piece down here. Something like that. And here comes a very important part. So I'm going to place this piece at the level of the scaphoid bone. So why I'm doing this? Because I want that the pulley forces go at the down to the scaphoid. So at this level here. If you check on your own end, the flexion direction of each finger is not perpendicular, is not vertical, but goes a bit diagonal progressively from the index to the pinky, so that the direction is indeed a bit more this way. If we pull in this way, we are going in a correctly biomechanical way. If we pull vertical, we are creating a joint deformity. So we have to take attention where is the direction of the pulley system. Another thing that we should take into account is that we want to have forces that act perpendicularly to the skin. So if I want to flex the metacarpophalangeal joint of the pinky, I want the pulley system to be perpendicular to the first phalanx. Okay, so the more the patient is rigid, the more the metacarpophalangeal joint perpendicular point will be high, so will be very distant from the wrist. A trick to get it a bit closer is to put the wrist more into extension. So if you put the wrist more into extension, the perpendicular point will be closer to the wrist. So if your main outcome is to regain some mobility of the metacarpophalangeal joint and the interphalangeal joint, my first suggestion is to make the wrist orthosis with as much wrist extension as possible. So first we make the patient wear again the orthosis, and we close it this way. And then we need to place a piece of thermoplastic material at this level that is facing upward this way. So I made the piece very big because I wanted to have enough material to stick to the orthosis and to be stable enough. And then I'm gonna search for the optimal point to put the outrigger. What I also need to do is to put Velcro on the proximal side of the for the orthosis, so that I can attach each outrigger to the orthosis. So for instance, in this case, I will use again some adhesive foot Velcro. I can either scratch the outer part of the orthosis to be uncoated and hit both sides, or just place it this way. Because it's very big piece, it could stick even without the need for heating. Okay. This will be the attachment for the outrigger of each finger. And then I need again cut some small pieces of loop Velcro that I will use as attachment for the outrigger. The fabrication of this kind of solution will take time, but will be time saving in the long period, in the long term, as we may want to recover from severe hand rigidity. And the patient can itself exercise and work on his hand rigidity during the day, which is important. We make a hole on one hole on each of these. So at this point, we want first to put in the proximal part, then the distal part of the outrigger system, and then this is the most important point. We want to search what is the proper inclination of the outrigger. So I see, for instance, that this could be ideal. Yes, so I insert already in the holes of the outrigger system the two wires, and then I can pull this way. Yes. Once I'm in this position, take a piece of Velcro and I attach the piece of Velcro to the main hook Velcro, so in this way. Then I check, okay, maybe this is the initial position for the patient, and I will make a loop to close it. We want to make a double loop to be sure. Yes. Then I can cut what is the exceeding wire. I suggest always to put more wire than needed, so you will be sure to have it. And now the first pulley system of the index finger is made. So we start from this position, then we help the patient flex as much as possible the finger, and then we fix the finger in such position. And this is a nice pulley system to work both at the level of the metacarpophalangeal joint and the interphalangeal joint, and is indicated for patients with finger rigidity. We can make this system identical for all the fingers. I'm gonna do that, and it doesn't matter where you're gonna place this Velcro, if it goes more on the left or on the right, because the importance is the outrigger at the level of this point. Once the outrigger is in this point, doesn't really matter where you are going to place the Velcro. And this is important to know, because when you will have 4 of these, for instance, at this level, you might wonder, okay, where do I put all these Velcros? But you can freely decide where to put them. Okay, let's make the second one. So the second one is done. Middle finger this way, identical to the other finger. I search for the outrigger, and then I could attach where the flexion was adequate. So I started by flexing the finger, so the therapist helps the patient to flex the finger, and then the Velcro is positioned this way. And this is for the middle. I'm going to do the same for the other 2 fingers. And this is as you want to position them at rest. Okay, so for instance, in this case, we have to know. I want you to notice that the loop should be as little as possible, because if we make it too big when we flex the whole system, it will be touching each other. The pieces will be touching each other, and that will not guarantee that you can flex as much as possible. So make sure that you make it as little as possible. Just the tip of the index can enter. The tip of the finger can enter, like this way. And this is the same for the part made out of thermoplastic material. So as always, first the proximal part, then the distal. And again, I have a pulley system for the finger. I have to find just the right spot for the outrigger. I take advantage that this particular sheet of thermoplastic material has holes enough big to make it pass through. If you don't have it, and you can always make the holes on the corresponding spot with a specific tool here. So you can make holes or directly on the thermoplastic material for the outrigger, for instance. So, as we saw for the first two, this is again a stabilization into flexion of the metacarpophalangeal joint and the interphalangeal joint. And then I can attach this as well. So these are 3 out of 4. And we do the last one for the pinky. Okay, so here we are with the last finger, the pinky. Again, I search for the optimal outrigger. Okay, and now I have also the outrigger for the pinky. As you can see, it's very diagonal compared to the other fingers. And this is the final result for the pinky, so that I can flex the metacarpophalangeal joint, the interphalangeal joint on the pinky, and stabilize at the level of the velcro proximally. So, the final result of this orthosis is the following, that we can put into flexion one finger at a time, like I already started with the pinky. Then I'm gonna put first proximal component, then the distal component, this way, yes. Then I'm gonna help the patient to pull and flex the finger to the desired position. Then I'm gonna block it by attaching the velcro here. And then I'm going to do it so identical. And it's best to do for one finger at a time to avoid that the pulley system gets impinged with the others. So by putting this way, we then help the patient by flexing, and then we pull and we touch the velcro this way. More space, so. And then with the last one, we detach first, yes. First the proximal part, then the distal one, so, okay, and then we can, pull this way. So this is the final result. We just made a wrist and orthosis with a pulley system to recover the flexion of the metacarpophalangeal and interphalangeal joints of the index, middle ring and big finger. When we want to detach it, we should do one at a time. So one finger gets into extension, then you attach it, you detach from the finger, and then you attach back, pulled this way to the orthosis. Then you attach here, attach from the finger, so, and then you attach back this way to the orthosis, and the same for the other 2 fingers. And the last one. So and so you can try to keep relatively in order the orthosis. Some recommendations, so this pulley system should be used for a few minutes a day and respect the pain at the level of the hand, so the patient can exercise also by himself if it's cognitively capable of it, but should not force the fingers against pain, because pain is a sign that the force was too much or exerted for too long time, and if you don't respect this, the joints will get inflamed, and then this will be create other problems. So it's ideal that you respect pain, and that you exercise for a few minutes per day, or if possible 10, 15, 20 minutes could be an optimal level. The ideal is that it's better to exercise for 10 minutes at a low intensity than for 1 minute, for instance, but a high intensity. So long period of time, progressively longer period of time with a relatively low to medium intensity, and always respecting the level of pain. Okay, at this point we still have the original hand orthosis with this new pulley system settled, but maybe the patient recover enough finger flexion, so enough metacarpophalangeal and interphalangeal flexion, so maybe we want to get rid of this system as well. So as we did with the stabilization for the thumb, we just take this out. This way, and on the back. And then we are again with our initial orthosis.